Hey guys, you might have heard your dentist or your hygienist talking about gingivitis or periodontitis or periodontal disease and wondered what exactly is the difference between the two, or are they just trying to scam me or something like that? So basically both gingivitis and periodontitis are versions of gum disease. So gingivitis is the most mild version of gum disease there is, and periodontitis is a more severe form, and it kind of varies in how severe it can be. So gingivitis means you have inflammation of your gums. So you have these gums that surround all of your teeth. If those gums start to get inflamed, that's when we have gingivitis. And underneath those gums, we also have a lot of bone. And those bones are kind of what anchor our teeth into our jaw. Now, if you have these unhealthy gums, there's also a chance you have unhealthy bone. Now this is where you get into the territory of periodontitis. So why do you get this gum disease in the first place? Well, it could be a lot of things. It could be you're not brushing and flossing enough. Yes, both are very important. Or it could be that you're simply neglecting going to the dentist. When you go to your dentist and your hygienist cleans your teeth, they're not just doing the same things you do at home with your toothbrush. They're actually scraping away something called tartar or calculus. Now this tartar is basically this biofilm of these bacteria on your teeth that have gotten calcified, meaning they have gotten kind of hardened and stuck to your teeth. And sometimes there's really no way of preventing this tartar from building up. Even if you brush and floss every day, you can still have some of this tartar build up. And some people are simply more prone to getting more tartar. And the thing with this tartar is there's no way you can really remove it with your toothbrush or with your floss. The only way to really get it removed is by going to a hygienist or a dentist and having them scrape it away. If this tartar is not cleaned away, then it's going to cause more inflammation because this biofilm is kind of stuck there and it starts building up more and more. You can also get gum disease if you're dehydrated, if you're not drinking enough water, or even if you're a mouth breather. If you're constantly breathing through your mouth instead of your nose, then you're going to be drying away a lot of the saliva in your mouth. That's going to protect you from getting this gum disease. You could also not be getting enough nutrients like fruits and vegetables. You could also be snacking too often. And the more you snack, specifically on carbohydrates, it's going to lead to more bacteria in your mouth and more plaque buildup on your mouth. Now, what's the difference between gingivitis and periodontitis? So like I said, gingivitis is the lowest form of gum disease. And the thing with gingivitis is it's still reversible, meaning if you correct it early enough, you can still go back to normal, like no harm done. So some signs of gingivitis is you have a lot of buildup, like a lot of plaque on your teeth. You can also have some swollen gums where your gums look a little puffy. Your gums can also look a little red, and they can also be bleeding. So like if you brush your teeth or if you floss your teeth and your teeth start to bleed, that's a sign you have gingivitis. So how do you cure gingivitis? Well, you need to clean your teeth. So you need to go to the hygienist and they will kind of clean all your teeth, and then you need to maintain that at home by proper brushing and flossing. And if you maintain this, your gums can kind of bounce back and get less puffy and get more firm and get healthy. The thing to not get discouraged about is if you start flossing your teeth and then your gums start to bleed. A lot of people tell me that and they say that I stop flossing my teeth when I see my gums bleeding. That's actually the opposite of what you should be doing. Your gums are bleeding because they are inflamed. There's more blood supply going to that area. So when you touch those gums and you kind of clean away some of those bacteria and that plaque, then they're bound to start bleeding. But that means you need to keep cleaning them away regularly. If you keep up the flossing for a couple weeks, you'll see that that bleeding will greatly reduce and probably even stop. Now let's say that this gingivitis is left untreated. That buildup of those plaque and bacteria can start to build up more and more. And eventually they can work their way underneath your gums. And once they're underneath your gums, they can start spreading to the bones that surround your teeth. And here, they're going to keep causing more and more of that inflammation. And at this point, they're going to start eating away at the bones that surround your teeth. At this point, it is irreversible. You cannot take back the bone that has been eaten away. At this point, you need something called scaling and root planing, or a deep cleaning. And what they're doing here is they're going to be cleaning away below your gums because that's where all that tartar and gunk is. And that's the only way to prevent this issue from getting worse. And that also means that you're probably going to be coming more frequently to the dentist. Like instead of 6 months, you're probably going to be coming every 4 months or 3 months. Now, if this is happening to you, it doesn't mean that you have to panic, because depending on how early you catch this, if you catch it early enough, then everything can kind of go back to normal still. Yeah, you might lose a little bit of bone and that bone loss is irreversible, but if you still catch it early and your teeth are still stable and you don't have a whole lot of bone loss, then you can still be on this maintenance period and you won't be at a high risk of losing all your teeth due to bone loss. Now, a lot of times after that first year, if everything starts to look a lot better with your gums, then you can go back to coming to the dentist every 6 months like normal again. The only difference now is instead of being called a normal cleaning, it's going to be called a periodontal maintenance. But let's say that you still wait longer and longer and you don't get it treated early. Now more and more of your bone is going to be eaten away, and eventually it can get very severe. This is when you have more and more risk of losing all your teeth. And not only that, you're at risk of getting infections because you have these deeper pockets that surround your teeth, and as these bacteria travel there, they can cause an infection somewhere as well. So kind of a recap, a sign you have gingivitis is you have some swollen, puffy looking gums or red looking gums, and they are starting to bleed. But now signs that has progressed to periodontitis is now you have some bad breath, you have really tender gums, you have even more puffy gums, even more red looking gums. You can also have some gum recession where your gums start pulling away from your teeth. And the reason that that's happening is because of the bone loss. So as your bone gets eaten away, your gums tend to follow it. So that's why you get that gum recession too. Or other signs are your teeth are starting to get loose or mobile. If this is happening, then you know that you're at those later stages of that periodontitis. Other signs of periodontitis are if you're having pain, like pain when you're biting down or chewing something, or you feel like your bite has changed overall. These symptoms could mean something else as well, but they're also a sign of periodontitis, so definitely get it checked out. Now, something else to note here, if you smoke or use tobacco, then your gums are probably not going to bleed and not look as red. But you still could have some sort of gingivitis or some sort of periodontal disease. And actually smoking or using tobacco products will make your gum disease and periodontal disease worse. So it's definitely still important, even if you don't have these signs and symptoms of your gums turning red or etc., to still go to your dentist. Now, how does a dentist check and see if you have some sort of gingivitis or periodontal disease? Well, we talked a little bit about some of the symptoms that you can check for, but a dentist or a hygienist will basically check for the same things. They'll check your gums and they'll see how healthy your gums are, and they'll also probably do some sort of probing where they basically put a probe in each of your gums and kind of see the depth of your pockets. Ideally, the pocket depths around our teeth should be between 1 and 3. If you start to see some 4s or some larger numbers, those are bad signs, and again, signs that your bone has started getting eaten away and that disease is progressing to periodontal disease. Now, larger numbers from this probing could also mean something else, but again, this is also why it's important to go to the dentist so they can check and see what exactly is going on. They'll probably also check your x-rays because your x-rays can show your bone level. If it looks like your bone is at a perfect level, then that's a really good sign. But if it looks like some of your bone has started receding a little bit and we're seeing a lot of tartar buildup, those are also some bad signs that there could be some periodontal disease going on. Now, it's really important to not neglect your oral health because there's a lot of studies linking problems with your oral health and specifically periodontal disease with problems with the rest of your body, like heart disease, diabetes, and even potentially Alzheimer's. So if you haven't been to the dentist in a while, make sure you go. Hey guys, so I thought I'd share with you what I do every single day to never get a cavity. So I'm not trying to brag or anything like that, but I do know a lot of people are making some simple mistakes, or they just don't understand simple things that they can start doing so that they can never get cavities. So how does a cavity form in the first place? So a cavity forms from the enamel